Hello, I am Ted Dahalski, an environmental health technical specialist with the Wisconsin Department of Agriculture, Trade, and Consumer Protection. Today's session is part of our update series of the Revised Lodging Rule Wisconsin Administrative Code ATCP 72 Hotel Motel Tourist Rooming Houses, which went into effect on January 25th, 2026. In this module, we'll focus specifically on plumbing-related requirements. We'll review potable water systems, plumbing and wastewater systems, and briefly discuss waterborne disease considerations relevant to lodging facilities. Before we get into the rule language, I want to highlight how inspection and licensing services are structured across the state. In the gray shaded counties on the map, inspections are conducted by DATCP staff. The yellow shaded counties, services are provided through our agent local health department partners. If your facility is located in a yellow shaded county, then your point of contact for licensing and inspection services would be your local health department. Any general questions can be directed to your local health department or DATCP at datcapdfrsrec@wisconsin.gov. The next two slides provide an overview of the rule structure, which is organized into 6 subchapters. Today we'll focus on a few key pieces within these sections. This slide shows the remaining 2 subchapters of ATCP 72. Subchapter 5 outlines the general provisions that apply to all lodging facilities, including health and safety standards, water and sewage systems, building maintenance, employee health, waste handling, guest registration, and reporting requirements. For this module, we'll focus specifically on the plumbing-related requirements contained in Subchapter 5. We'll review key requirements related to safe drinking, proper plumbing design and maintenance, and the collection and disposal of wastewater. These systems play a critical role in protecting guest health and preventing contamination. Potable water must be safe, sanitary, and supplied in a manner that protects against contamination. This includes water used for drinking, food preparation, and bathing. We'll review requirements related to approved water sources, system operation and maintenance, and protections such as cross-connection control and backflow prevention. We'll also discuss monitoring and response expectations when water quality concerns arise. Potable water, meaning water used for drinking, food preparation, hand washing, bathing, or other sanitary purposes, must be supplied from either a public water system or private water system. Most lodging facilities, particularly larger hotels and motels, are connected to a public water system. This is typically a municipal community system, or in some cases, a transient non-community system, which is one that serves at least 25 people on 60 or more days per year, or it may be an other than municipal community system that serves at least 25 non-transient people. Public water systems are routinely monitored and tested by the Wisconsin Department of Natural Resources or by delegated local health departments. Smaller facilities or those located in more rural areas may instead rely on a private water system, more commonly a private well located on the premises. These systems serve a smaller population than a public system. While private well construction is regulated by the Wisconsin Department of Natural Resources, ongoing maintenance and water quality monitoring are the responsibility of the well owner or operator. In some situations, a private well may be shared by 2 or more properties. In those cases, operators may be required to provide a signed shared well agreement. This agreement outlines the well's location and clearly identifies the parties responsible for maintenance and operation. These agreements are often recorded with the County Register of Deeds office. There are 2 key contaminants that private wells serving lodging facilities must be tested for on an annual basis: bacteria and nitrate. Coliform bacteria are a group of commonly occurring bacteria found in the environment and are used as an indicator organism to determine whether a waste system may be contaminated. If a water sample tests positive for total coliform bacteria, follow-up testing is conducted for E. coli. E. coli is a harmful pathogen that can cause serious illness, particularly in young children, older adults, and individuals with weakened immune systems. Nitrates are compounds that naturally occur in soil and may also enter groundwater through fertilizers and other organic sources. Elevated nitrate levels are those exceeding 10 milligrams per liter or ppm and can pose significant health risks, especially for infants and pregnant individuals, and have been linked to certain thyroid conditions and cancers. Both bacteria and nitrate testing are required annually for private water systems serving lodging facilities. Resources for private well owners are available through the Wisconsin Department of Natural Resources. These resources can be accessed by scanning the QR code on this slide or by visiting dnr.wisconsin.gov/topic/wells. The DNR website provides information on certified laboratories, proper water sample collection technique, information on how to read your private well lab report, and recommended actions if a water sample tests positive for contamination. If a private well tests positive for coliform, E. coli, or nitrate, ATCP 72.162H outlines the required actions to protect guest health. If total coliform bacteria are present on 3 consecutive well water tests, the water system may not be used for drinking water. If nitrate levels exceed 10 milligrams per liter or ppm on any well water test, the water system may not be used for drinking water or food preparation. In these situations, operators must provide an alternative potable water source. This may include commercially sealed bottled water or water supplied through a licensed water distribution service. If E. coli is detected on any well water test, the private water system must be taken out of service immediately. The presence of E. coli is considered an imminent health hazard, and the affected areas, individually keyed unit, or lodging facility may be closed until the contamination is corrected and safe water service is restored. Plumbing systems must be designed, installed, and maintained to ensure the safe distribution of potable water and the effective removal of wastewater. We'll review key requirements related to system maintenance protection from cross connections and adequate water temperature and pressure. Facilities must be provided with a potable water source under adequate pressure to ensure fixtures function as intended. Hot water must be available at all hand washing and bathing fixtures to support proper hygiene and sanitation. Plumbing fixtures must be maintained in good repair and kept in a clean and sanitary condition. This includes promptly addressing leaks, broken fixtures, or other conditions that could impact guest health or safety. Finally, all water-carried waste fixtures must discharge properly to approved wastewater systems. Each individually keyed unit must be equipped with, at a minimum, 1 toilet, 1 sink located in or adjacent to the toilet room, and a shower or bathtub. In addition to these plumbing fixtures, the toilet room must be supplied with soap, toilet paper, and a means for drying hands, and a waste receptacle. Soap may be provided as a single-use prepackaged product issued for each guest stay, or through refillable or reusable soap dispensers provided they are properly maintained. Operators of water-jetted fill and drain bathtubs must be able to demonstrate knowledge or describe their cleaning and sanitation procedures. These tubs present unique challenges because water can remain in the piping between uses. If not properly addressed, the retained water can allow bacteria to grow within the system potentially cause illness. Manufacturers provide specific cleaning and maintenance instructions for their products, and those instructions should be followed. In general, best practices include filling the tub with water above the highest jet, adding an appropriate detergent, and circulating that water through the system for a designated period of time. The tub is then drained, refilled with clean water, and the sanitizer solution is added. The jets are activated again to circulate the sanitizer, after which the tub is drained, rinsed, and cleaned. Both bathtubs and showers are required to be provided with a slip-resistant flooring. Slip-resistant flooring may be achieved through a variety of methods, including a textured tub or shower surface, grouted floor tile, non-slip mats, or an anti-slip tape product. Whichever method is used, it must be maintained in good condition to effectively reduce the risk of slips and falls. Backflow prevention devices are used to prevent contaminated water from flowing upstream or back siphoning into the potable water supply. Approved backflow prevention devices will be labeled or stamped with an American Society of Sanitary Engineering or ASSE rating. Example of common backflow devices encountered in a lodging facility will include a mop sink or janitor sink, vacuum breaker spout with an ASSE 1001 rating, a hose bib vacuum breaker with an ASSE 1011 rating, is also common and are typically threaded onto standard utility faucets used for hoses. Chemical dispensing systems often found in housekeeping or laundry areas require an ASSE 1055 rated backflow prevention device. And lastly, a frost-free outdoor faucet are equipped with an ASSE 1019 backflow prevention and are most commonly found on the exterior of a tourist rooming house. One of the most common backflow issues identified in a lodging facility involves the drain line of a commercial ice machine. In many cases, the ice machine drain line is improperly inserted into the floor drain and is in direct contact with the drain or position below the flood rim. This creates a potential backflow and contamination risk. To prevent this, an approved air gap is required as illustrated on the right side of the screen. An air gap is a physical separation between the end of the drain pipe and the flood rim of the receiving drain. If the waste pipe is 1 inch or less in diameter, then the air gap needs to be at least twice the diameter of the waste pipe. If the waste pipe is larger than 1 inch in diameter, then the distance of air gap needs to be at least 2 inches. This section addresses wastewater systems in lodging facilities. Wastewater systems must be designed, installed, and maintained to safely collect and dispose of wastewater generated from plumbing fixtures. This includes sinks, toilets, showers, bathtubs, and other water-carried waste fixtures. As previously stated, all water-carried fixtures, to include sinks, toilets, appliances, and showers and bathtubs, must discharge properly into an approved wastewater system. These fixtures must be connected either to a private on-site wastewater treatment system, more commonly known as a POUTS or septic system, or to municipal sanitary sewer. Alternatives to water-carried waste plumbing fixtures such as portable toilets, composting toilets, incinerating toilets, or privies need to comply with the Wisconsin Department of Safety and Professional Services construction standards and may require local government approval before use. For questions regarding allowable wastewater systems or local requirements, operators should contact their local zoning or permitting authority. When a private on-site wastewater treatment system or POUTS is used, there are several important considerations to keep in mind. Any cleanout covers that are exposed above ground must be secured to prevent unintended access. This is typically accomplished by locking the cover to the concrete riser or by using tamper-resistant fasteners designed for this purpose. Proper maintenance of the POUTS is essential to ensure reliable operation and to extend the life of the system. Local zoning or permitting authorities oversee inspection and maintenance of these systems. Operators should also be alert for signs of system failure, including ponding on the ground near the tank or drain field, discharge of sewage to surface water, or sewage backing up into the building. If any of these conditions are observed, the local zoning or permitting authority should be contacted promptly. Waterborne disease outbreaks can be caused by a variety of infectious agents, including Legionella, Pseudomonas, Campylobacter, Cryptosporidium, E. coli, and Giardia. A waterborne disease outbreak is defined as 2 or more people that experience a similar illness after exposure, ingestion, or inhalation of water that epidemiological evidence implicates as the probable source of the illness or meets other exposure criteria for that specific disease. Understanding how these outbreaks occur highlights the importance of properly designed, maintained, and monitored water systems in lodging facilities to protect guest health. The most common waterborne disease outbreak investigated in lodging settings involves Legionella pneumophila. Legionella pneumophila serogroup 1 is the strain most frequently associated with Legionnaire's disease. Legionnaire's disease is a severe form of pneumonia that can result in a serious illness and in some cases death, especially among older adults, current and former smokers, and individuals with weakened immune systems. Legionella bacteria naturally occur in freshwater environments but can enter and become established within the building water systems. Once introduced into the built environment, Legionella can take up residence in the potable plumbing system, in whirlpools and hot tubs, and also in decorative water fountains or cooling towers. These systems can create conditions such as warm water temperatures or stagnant water that allows the bacteria to grow and spread. Contaminated water is then aerosolized by plumbing fixtures, such as the potable water system shower heads, whirlpool or spa jets, cooling towers, or decorative fountain spray features. These fixtures can produce fine water droplets that allow Legionella bacteria to be carried into the air and inhaled by occupants. These contaminated water droplets can then be inhaled into the lungs, allowing that bacteria to enter the respiratory system and cause infection. Depending on the individual and their underlying risk factors, exposure to Legionella can result in either Legionnaire's disease or the less severe illness known as Pontiac fever. A public health outbreak response begins when the Wisconsin Department of Health Services sends notification of a suspected Legionella outbreak involving 2 or more individuals who test positive and share common exposure locations, such as a lodging facility they visited or stayed at. Once notification occurs, public health officials coordinate with the operator to conduct an on-site environmental assessment. This includes a facility walkthrough, collection of water samples, and completion of the U.S. Centers for Disease Control and Prevention environmental assessment form. Areas of focus typically include the potable plumbing system, whirlpools or spas, decorative water features, and cooling towers. If any test results return positive for Legionella species, affected systems or areas may be closed to the public or required to implement interim protective measures, such as point-of-use filtration, to reduce exposure risk. Following remediation, public health officials will resample to confirm that corrective actions were effective. After validation, the operator is responsible for implementing and maintaining a water management program, including ongoing monitoring and periodic testing for Legionella as outlined in that program. The water management program is a structured step-by-step risk management plan designed to prevent and control Legionella growth within the building's water system. Water management programs are based on nationally recognized guidance such as ASHRAE standards for Legionellosis risk management, and focus on identifying water systems that could support Legionella growth, establishing control measures, monitoring system performance, and responding when conditions fall outside acceptable limits. Implementing a water management program helps facility operators proactively reduce the risk of Legionella exposure and protects building occupants. The CDC has established procedural steps and a toolkit to assist lodging facility operators in developing a water management program. These resources provide a practical framework for identifying water systems that may support Legionella growth and for implementing control measures to reduce that risk. Operators are strongly encouraged to implement a water management program as a proactive measure to help prevent Legionella outbreak in their facility. A well-designed program supports routine monitoring, documentation, and corrective actions when conditions fall outside of the acceptable limits. Hospitality and recreational water facility resources are available through the CDC website. These materials can be accessed by scanning the QR code on this slide or by visiting cdc.gov/control-Legionella. Thank you for taking the time to review the ATCP 72 lodging rule updates related to the plumbing requirements. If you have any questions or need further clarification on any of the topics covered today, please reach out to the department at DFRSREC@wisconsin.gov. We're here to help support you as you navigate these new requirements.